Adolescent Health enough time to share his work. So this is our last seminar of the year, December. So I'm super excited to have Eric back. He used to be at our center, and now he's moved on to hopefully bigger and better things. So he'll be presenting on how to collect longitudinal social network data in unbounded networks of homeless youth. And I'm very excited to welcome him back, and I'll turn the floor over to Eric.
It's really fun to be back because I mean this is probably the least stressful audience of people I can kind of imagine. It's sort of it's like such a homecoming, you know. It's like, oh, these are all people these are all my friends, and you know, and you guys haven't seen a lot of this work yet, so I'm excited to share with you where we're at. And in some ways, you know, Norita's seen some of this as we've been going, and on some level, this is a little bit of me talking about how I collected this data, the problems that it's posing, and what I've started to conceptualize as the main outcome paper, and I'll share with you a little of that. But this is probably going to present more questions than answers today, but I'll share with it anyway. So, a huge group of people, particularly Harmony, Haley, and Norita, who've helped me with this, and then my Ph.D. students, and then some field staff who all helped make all of this happen. So, okay, so in an hour, I will try to, or less than an hour. I don't mind people people interrupting me, so if there's something that you want to ask me about, please go right ahead, and I'll figure out how to get through the slides as best I can. Kind of talking about the problems of unbounded networks, talking about what I did to try to solve that problem, talking about the complexities of actually constructing these networks, which is not a small feat. And then I'm going to share with you some of my preliminary overtime network results. And I should probably put the overtime in parentheses or quotes or something like this, because I feel like I'm not doing a very good job of really capturing. I have yet to figure out how to do some good statistical models with the longitudinal data. And I feel like mostly I've been able to talk about how things change in these networks over time, but not really more than that. So I'll share with that. And then implications for prevention intervention. So this is where I was saying that I'm going to share with you kind of my preliminary main outcome paper. So really the idea being that there's been some desire to implement some peer-led HIV prevention interventions for homeless youth for quite some time now. And one of my desires is to use these data to try to talk about what might be some of the implementation challenges if we were to do that. And I think that these data suggest that it's not an impossible task, but it's very difficult for some very specific reasons that we're going to have to figure out. Okay, so not that I have to probably sell you guys on the importance of homeless youth considering where I'm at. So I know a bunch of you have worked on homeless youth, but you know, there's almost 2 million of them every year. The HIV prevalence rates have been as high as 11%. There's very few evidence-based interventions for them. Primarily, I mean, you know, Mary Jane's Street Smart being probably the single best still to date, and that's from whatever 1996 or something. So I mean, it's been a long time, and she herself, you know, wrote some work with Elizabeth Arnold a few years ago, really talking about how she thought that maybe peer-based prevention would be the next wave of things to do with these youth, given how transient and how disconnected from adults they are.
Pardon my interruption, but it's the 11.5%. Is that typical, or is that, I mean, is it more commonly?
It's usually more 2 or 3%, which is still 10 times what you see in typical adolescent populations, but it's usually more 2 or 3%. The 11% is a pretty, that's an outlier, but it's not. That one was from a study done in San Francisco, I think Larkin Street actually, back in the mid-90s. And then there was, I mean, honestly, I think some of the best, sadly, the best data has been from self-report data from studies like Norita's Project I or Joan Tucker's study over at RAND, where they did sort of representative samples of homeless youth and then asked them, have you been tested for HIV, which most of them have been, it turns out, and then what their status was, and then those end up being 2 or 3% is where so that's probably a more reliable number than the 11% number. Right, so in the last few years, so starting with this article in 2009 that Elizabeth and Mary Jane wrote, they really did sort of a systematic review of HIV prevention interventions for homeless youth, and really were advocating for peer-based prevention, network-based prevention. Hank Green and Joan Tucker and some other folks at RAND wrote a paper about a year ago or so now, where they essentially thought that their data was really strongly in support of that. Harmony Rhodes and I wrote a response to that article basically saying that we thought that they were only able to say that because they were looking at these person-level networks and that they weren't really looking at the population-level networks. And as soon as you start to look at the population-level networks, things get a lot more complicated and maybe not as easy as they think. Wait a minute. Okay, all right. I'm not quite sure this is how I was fooling around with the slides at the last minute, guys. Sorry about this. So as kind of the final lead into before I actually get to what I did, there's a few assumptions that peer-based prevention is based on. And I think these data allow us to look at some of these issues and think about how realistic peer-based prevention can be and what some of our the impediments might be. So one of the things is that there's the assumption that youth are going to be connected to one another so that they can actually spread messages from one youth to the next. So on some level, we're assuming that these networks have some high degree of connectivity that's going on, or even if maybe there's not a very dense network where everybody knows one another, at least it spreads out into chains where we can eventually get to most people. So we need to look to see if that's actually the case. There's also some understanding that we've got to have some stability over time. I mean, I know from Lily, we did the POL in China, and you guys picked peer leaders that were folks that were going to be in those stalls consistently for some period of time so they could be doing this outreach work. And so the issue here is, do we really have a stable enough population to really be able to train them and expect them to be around for a period of time? And then another question is really what kind of communication actually is happening in these networks. So do these young people actually talk to one another about HIV prevention at all? Do they talk to one another about using condoms at all? And so even though I think a good POL model would want to prime people to have those conversations, it's still, I think, useful to know how much of an uphill battle is that going to be. So that's kind of where I'm going to try to use these data. So what's the problem with these open systems? So the issue with the homeless youth is that who is a part of the network can really change almost on a daily basis. And so on any given day when you're looking at a particular network of young people, there may be new kids who have just run away and hit the streets. There may be young people who've just gotten themselves into stable housing, and so they're no longer a part of those networks. I mean, and we know that there's churn. I mean, we know that young people, I mean, this is particularly Norweda's findings, but we know that young people, like, they run away, they go back home, they run away again, they go back home, they run away again, they go back home. And we also know, just from looking at agency level data, that there's a fair amount of turnover at these drop-in centers in terms of how many young people, access these drop-in centers. So the population is kind of moving. And so social work researchers love to call it, open systems. So really, when you've got one of these unbounded networks, network scientists talk about there being 3 ways that you can collect these data: the positional approach, the network expansion approach, and the event-based approach. And so, unfortunately for Norweda, she's had to hear this spiel a million times, but the rest of you haven't heard it as much. So the positional approach essentially is what you can do if you've got a fairly open system, if you have some sort of roster. So you could imagine that this might work well if you had a shelter where you had a relatively stable number of young people for maybe a month that are in this shelter, and you could actually have a list. This works really well for schools, right? You actually know which students are a part of that. Now, there may be people who are in their networks who they are not in that high school, but it's a way of bounding a system and sort of saying, well, we're interested in the population of these young people who are in this high school and how are they connected to one another. And we can get that through this positional approach, which basically means we have a list. Network expansion is essentially like the respondent-driven sampling idea. So you pick a couple of key nodes that you think are important people in your population, and then you develop some method for expanding past those nodes to the next nodes. So with respondent-driven sampling, it's bring in 3 of your friends or 5 of your friends, and then we'll ask 3 or 5 of your friends to bring in more people. Sometimes people have used a technique where as people nominate folks in their networks, if at least two people have nominated some third party, then you go and get that next third party, and you kind of keep expanding out like that. There's a few other techniques, but those are sort of the basic idea. That, for me, doesn't seem to be quite as desirable for homeless youth, because there may be a good chance, from at least my experience being in drop-in centers, that a lot of homeless youth who are really part of this population may keep themselves relatively distant from other homeless youth, which leads then to this third possibility, which is the event-based approach. And this is in some ways the simplest answer to the problem. So what we do with the event-based approach is that you define some sort of social, physical event that you think can be used to put a boundary around the population. So the guy who developed this is this guy named Lynn Freeman, who's at UC Irvine, or was at UC Irvine, and he was interested in looking at people who were the regular goers to a beach. And so what he did was he decided he's going to basically camp out in a physically demarcated stretch of beach in Orange County for a month, and he was going to watch everybody who came into that beach. And anybody who came at least 3 times, he was going to go talk to them and interview them and talk to them about who else they were connected to in this network. So what I decided to do was basically treat the homeless drop-in centers like a beachhead. So I thought, okay, well, at these drop-in centers, you've got homeless youth coming in to access really basic level services, which usually is food. So it's going to be food, sometimes case management, sometimes clothing, but it's most of these drop-in centers are pretty low barrier. You basically have to get into a fight with somebody in order to be kicked out of these places. So you see there, at least in my preliminary work, I had seen over the years that there was kids who were sleeping under bridges who were there are kids who were in transitional living programs that were there, people who had just gotten themselves stable but really were kind of in and out of the streets who would still come there. So you had this sort of full spectrum. And really the only young people that you don't have in these drop-in centers are people who have decided to entirely distance themselves from any kind of service delivery. And at least based on Norita's Project I data, that seemed like it was only about 5% of the folks that she sampled in her street samples were actually not going to any services at all. So it's pretty low barrier. And so what I decided to do was define the event using a particular agency for a particular period of time. So every single young person who came into one of the 2 agencies that I used as my sampling sites over the course of a month, and actually what we did was we did 19 days of service delivery, because one organization had they had service delivery 5 days out of the week, and the other one had it only on 3 days out of the week. And so in order to make them comparable in terms of how, how many days we were doing this catchment, we decided to do 19 days of service delivery, and why 19 and not 20, I don't know. It was like the first day we went out, we were going to do it for 4 weeks, so it was going to be 20, but then there was a day that they didn't have a day, so it became 19, and so after that point we just said, well, we'll stick with 19. So what we did was we had 2 people. We had somebody positioned at the door, so that, literally for both of these agencies, they had a sign-in place. So you had to wait in line to get into the agency. So one of them is in Venice, called Safe Place for Youth, and the other one is my friend's place, which is in Hollywood. And every single young person who came in the door, we had somebody who was waiting at the door to say, hey, have you been a part of our survey yet? If you haven't been, we'd like to talk to you if you're interested in it. And then we also had a second person who saw every single young person, who was running what we referred to as our computer lab, but basically we set up in a room at each of these agencies about 6 or 8, depending on the agency and the space we had for the day, computers where they would do the self-administered part of the interview, and we had a consistent person running that lab and then this consistent person interviewing. So we actually had 2 people that saw every single young person. We actually had one kid who at one point came in disguise, literally, so that he could do the interview twice, which was kind of funny. And we didn't realize it until we were like halfway through, and we're like, wait a minute, you're just wearing glasses and a funny hat. So, I mean, we may have gotten, actually fooled by somebody else who was a better disguise, but I think we did a pretty good job of screening that out.
So what were the study incentives?
We gave them $20, and so what we told them was it was going to take about an hour and a half to do the interview. So we had about an hour-long protocol for a self-administered survey, which was mostly asking them about risk behaviors and history of homelessness and because I'm really interested in technology use, things about how they're using technology, et cetera. But then we also had then a half an hour or so protocol that was the social network interview that I'll show you in just a second. That we developed this iPad app to collect the social network interview data. So what we did was, I used to do this thing where I had these big sheets of paper and I'd draw sort of a picture of the network, and then we would painstakingly, basically transcribe these pictures into a database and hope that we weren't, doing it wrong. So at some point, relatively early on, we decided to build this iPad app, and it works. It makes the whole thing really easy. So basically, what we do is we just we have about 17 prompts to ask people who it is that they've been communicating with for the last month. So we start off with this basic thing. We say, we're interested in who you talk to and who you spend time with. And that could be either online, face-to-face, over the phone, any sort of mode of communication counts. And then we ask them to start listing people. And as they start to slow down, we'll then say, well, how about any other friends, family members, case managers, people that you've been having sex with? And we had a list of literally about 17 prompts to get people to list out their networks. And so then they would list out their network, and and then we would subsequently ask them several pieces of identifying information about each one of those network alters. So we would ask them what their first name was, their last name, what their nicknames were, because a lot of these young people have these funny street nicknames. Then we would ask them about their gender, their ethnicity. We would ask them if that person had any visible tattoos, which actually was a really important thing that we started to do, and was a little bit difficult to get initially some of the young people to trust that we weren't the police cataloging their tattoos, because when you get arrested, your tattoos get cataloged. And so we had to sort of explain to them why we were doing this, that this was going to enable us to sort of take your map and somebody else's map and figure out how they connect together. And if you tell us about Mike, who's got a tattoo on his skull, of a skull on his shoulder, we're going to know that that's different from the Mike who's got a hatchet man on his shoulder, and that's going to help us figure out who's who. And that seemed to really, once they knew why we were doing that, and then we assured them about their confidentiality, they seemed to get on board.
Really quick,
yeah.
too, this reminds me of, there was a social network meeting I went to a few years back, and they had a similar iPad app. And they would do it where they could show the person the network that they had constructed based on that list, and they could see the connections, and sometimes people would say, oh, well, actually that doesn't look quite right. Just a visual representation, and they could literally change the connections.
Mine's not that sophisticated, but I'd like it to be at some point. Because the thing is, after we ask for this identifying information, which we kind of ask for on an individual level, then all of the remaining questions that we ask, we end up asking sort of the network as a whole. So, who did you know from home before you became homeless, for example? And so then you just tap on, and light it green, the people that you knew from home before you became homeless. And then at the end of the interview, when we ask who's connected to who, again, it just pops up and says, who does John J. know, who does Jacob know, who does Pops know, and you just tap this information in. And I think that if we had sort of a more sophisticated set of, I had limited resources around this, but I think that would be something really cool to actually get it to, just do a simple, graph. So because then you could even ask people, oh, it looks like these people are clustering together. Is that a particular group of people? And who would those people be? I think that could be a really. I know that there's a program. I believe that it's called EgoNet. I think is where you can collect network data and it actually can show you the visual of them afterwards. The problem with that program, or at least the reason why I didn't use it, was that you have to have a set number of people that you ask every single participant about. So you have to say, tell me about the 10 people that you're closest to, or the 20 people you've interacted with the most. And at least in my experience with the pilot data, I would have some youth who would talk about 30 people, no problem, and I had other youth that it was hard for them to talk about more than 3. And so one of the key dimensions that I was interested in was just how many people do these young people see themselves as connected to, as opposed to fixing the number. But I know that the people at RAND used that program, and one of the ways that they dealt with it then was to then say, well, you have to give us 20 people, but we're going to ask a lot of questions subsequently to figure out, well, how many of these 20 people do you really spend a lot of time with, and et cetera, et cetera. But I wanted size to vary for better or for worse.
It wasn't fixed.
Oh, really?
It could
See, that would be awesome. I should go to more social network meetings because I'm sure that there's lots of technology out there that I could take advantage of.
I'll just throw in, not to distract, but there could be a bit of a bias with getting information on the 20. It may be that the person that you're engaging in risk acts with is not somebody that you're spending the most amount of time with, right?
Totally. Right, and I think that also is something that I struggle with a little bit here, and we can see a little bit of it further on, because not everyone that's a sex partner gets talked about, and not in part because the way that I ended up creating this network was, so this is an example of the first wave of data collection, and so every single young person has their own egocentric, person-centric network that they describe to me. And so the red person is the participant, blue might be other participants, yellow might be family members, green might be home-based friends, orange might be a caseworker or something like this. That's a pretty typical network that gets described to me. But what I'm interested in, at least for today, although I do use these data some days, is taking the population of everyone who came into the drop-in center and everyone who we interviewed, because we got between 85 and 93% of the youth who came in the door would agree to participate during the 19 days. So we had a really high uptake. I mean, so we don't have a lot of missing data, at least with respect to the nodes themselves. And so then what we wanted to do is figure out how are those, in the smaller space about 150 nodes, and in the larger space about 200 nodes, how are those folks connected? And so what we wanted to do is basically figure out, if I'm talking about these 4 other kids that are in the agency, where are they located and how are they connected? And so what we did was we came up with sort of a set of decision rules. And so what we did was we literally went line by line through. So you can imagine we have 200 youth. On average, they have about 15 nominations. So each wave had about 2,600 lines, right? And we went through every single line and tried to figure out, is this person one of the people that we talked about, that's getting talked about is this person that's being talked about potentially another participant in our study? Some of it gets to be easy, right? Because anyone who's a family member that's over the age of 30, we could like scrape them out almost immediately, right? And then anyone who was a case manager. So there were some identifiers of people that we could use to sort of scrape that out. But then you still end up being left with about 1,500, 2,000, or so things where it's like, well, people that are about peer aged, and now we have to figure out, is this someone who is on the streets with them in our network or not? And so the easiest part of it was that for a large proportion of cases, the folks are naming or providing a nickname, gender, race, ethnicity, and tattoo description that made it pretty easy for us to tell whether or not it was somebody in that network or not. And then we had a couple of more complicated decision rules that we entered in. So one of them was, well, what do you do if there's 2 guys named Mike, right, who are white, and we don't necessarily know anything about, there's no tattoo that's differentiating them. So what we decided to do is we looked for the presence of a third shared alter. So if Alex is talking about Mike, and so if Alex is talking about Mike and somebody named Patches, and there's 2 Mikes, and one of them's talking about talking about Patches, one of them's talking about Alex, we'd be like, oh, okay, so there's this guy, Patches, who's talking about an Alex and a Mike, and then there's this guy, Alex, who's talking about a Mike, and there's this guy, Mike, who's talking about an Alex. So there's like this triangulation that we could do of it seems like there's enough shared people there that we could do this. And I probably need to do a better job of cataloging every time we had to do that procedure, because we actually have some notes as we went line by line about how we came up with some of the decisions. But in the end, we would. I had two guys who, Adam and David, who were my 2 main interviewers, and they actually during the month that they would be in the field, one of the other things that they did was they took extensive field notes of when they saw people that they knew were both participants talking to one another. So sometimes what we decided to do was essentially, well, so this person's talking about a mic, and we've seen them talking to that mic, but not this other mic. So we would go with that. In the end, we had them each individually go through the whole list of 2,000 possible matches, and typically in a given round they'd have about 90% agreement about what they thought, whether it was a match or not. And then so we ended up then with about 10% of these possible cases. So which ends up being like 100 people each round that you end up then having to decide, like, okay, now we need to sit and slog this out. At which point we brought in Haley, who I know some of you know, who was our other field interviewer, as a third party, and the three of them then tried to come to some consensus. And part of what they did with that larger consensus was they dug even deeper into the data to try to figure things out. So they started to look to see, okay, well, this person's talking about a mic, but they're saying that they're not a client, so maybe it's not this mic that is a client. Well, how do we know if that mic was the client or not? Well, we would also then look to say, like, well, if they also talked about that person being a sex partner and then said that that person wasn't a client, we'd say, like, okay, they know this person intimately enough to know that they're a sex partner, and so they probably ought to know if they're a client or not. We also had some rules of thumb that were around things like, how long have you known this person? So if you said that you had known the person for more than 6 months, we trusted your report on them more than people that you had known for less than 6 months. If you report less than 6 months, you may or may not know if they come to this drop-in agency. But if you've said that you've known them for 2 years, and you say that no, they're not coming in, then we're going to treat that as a no. So we had kind of this, I joked about it being kind of almost like a Sudoku puzzle. So sometimes you didn't necessarily know that this was for sure a yes, but you did know that it couldn't, the 9 couldn't go there. And that was actually, I think that we had a lot more confidence once we started realizing that we needed to rule people out as much as we needed to rule people in. So, and in the end, across there are a couple thousand ties that were agreed upon over the course of this study. There are only 8 matches that they just couldn't come to agreement on. So I feel like, for better or for worse, we came up with enough decision rules that there's some rigor, there's a lot of rigor to this decision, and we decided to go with a conservative matrix of ties. So if we thought this could be a match but we're not sure, we left it uncoded. And so this is I'll just share with you some of the data. So one thing, I'll share with you some of the demographics of the data first, so you can see that there's some consistency to this data, because then I'm going to show you that there's a lot of inconsistency to the data too. So this is network 1, that's network 2. You can see that across both networks, across all 3 waves, primarily male, minority female, very, very few transgender folks. Sexual orientation, primarily heterosexual, although a fairly large number of homosexual and bisexual identifying youth in both networks. The big difference demographically between these 2 networks is around race. So in this network, which was in Hollywood, you can see that the single largest ethnic group is African American youth, that's the green bars, whereas in Venice, it was white youth. Okay, what do these networks start to look like? So this is network 1, which is my friend's place, in the wave 1. So what you can see here is that, and I'll show you some quantification of this in a minute, but just kind of visually, what I used here was this routine from NetDraw called a spring embedder, which basically, it's an algorithm that pulls people who have more shared ties closer together toward the center of the page, and pushes people with fewer ties away from one another toward the edges of the page. So someone like this gets pushed way out because they're only connected to this person, who's only connected to this person, who's only connected to this person, whereas people like this, where there's 7 or 8 ties that they share, they are kind of pulled in tight together. There's not real, it's more qualitative though than quantitative, even though there's distinctly, there is an algorithm behind this, but you don't necessarily measure the distance and do something with that then subsequently. or at least I have never done that. So the thing that I want to point out is there's what network researchers refer to as a small world in the middle, which is oh, it's a small world because I know your friend who and 6 degrees of separation kind of idea. So here, and this is in some ways what would be the ideal situation for a popular opinion leader, would be that you've got, with enough connections, everybody's reaching somebody. Unfortunately, though, you can see that there's a lot of disconnection. So you have, and I'll show you the quantification of it in a minute, but it's almost a third of the network are young people who come into this space, and even though they will delineate their networks to us, and their networks are actually no smaller on average than the networks of these other youth, but it doesn't include anyone else who's at that agency. So they're coming into that agency, and they will delineate people that are staff at the agency as being, and in fact, they're, I think, even more likely to include staff than the people who are in the center. So their primary connection to this social space is the agency staff themselves. So perhaps if we were to include the agency staff as nodes in this diagram, we would actually get to them. But if we only include as nodes the youth themselves and only include the ties that are these communication ties between these youth, we get a lot of isolated youth, and we also get a lot of small components, so little dyads and triads that a lot of times they're romantic couples or traveling partners. So this is wave 2, very similar sort of structure. I mean, it plots out differently on the page. There's kind of a fair bit of chaos about this algorithm. Like if you rearrange where you start the dots on the page, you get a very different looking picture in terms of where any particular dot gets placed. I mean, you get sort of a consistent patterning of this small world and the components, but
it's just visually, it looks like there's fewer pairs that are by themselves.
Yeah.
The first one.
Yeah. So here there are more components in the first one than there are in the second one, and you also have in this second one this larger sub-network, this one component that's pretty big over there, which over here, you kind of had a chain that was about 5 people, but here it's about 10 people that are in a distinct component off to themselves. So it's, and I'll show you more in a minute how much difference there is.
The structure is kind of changing over the waves.
It is, definitely. And this one looks a little bit more like the first wave, even though it's laid out a little bit differently, but you can see that there's a bunch of dyads again here, and there's no particularly large sub-network. I mean, we've got 2 4-person networks, but nothing more than that. So this is the other network. So this is the Venice Beach network. So again, one thing to notice is it's a smaller network. There's just fewer young people at this space. Another thing is that this is almost its own network, save for this one relationship, which I think is kind of interesting. So you've got fewer of the components here. You still have some isolates, but maybe not quite as many. But also there's a size issue here at play. Wave 2, again, you continue to have this slightly more spindly network, again with some smaller components, and then wave 3, again. So, but there's definitely shift, and I'm going to show you some ways. So, this is quantifying these pieces, right? So, nodes are the people, edges are the ties between people. So you can see that I don't think of this as being a particularly consistent number of edges across the waves. Like I feel like there were moments in time when some of these networks were more interconnected than others. For example, the third wave of the Hollywood network has nearly 200 more edges than the previous ones, and then the third wave of the Venice network had nearly 200 fewer edges.
What was the period of time between waves and the seasonality?
Oh, I'm sorry. So there's 6 months between each wave.
Okay.
And in Venice, we had been told that there was a huge amount of seasonal variation between winter and summer in terms of how welcome the young people were in the space. Because in summertime, the cops run them off, and in wintertime, they don't. So we figured that would create kind of a weird network space. So we decided in the Venice Beach site to do it in fall and spring, which are sort of the intermediate zones. So this is spring of 2012-13. And then with Hollywood, they felt that they had a pretty consistent number of youth accessing when they showed us their agency records, they had a pretty consistent number of youth across the year. So we did them in summer and winter, because we needed, from what as I described, the labor-intensive process of creating these networks, we needed a lot of time after we got back from the field to put these things together. The number of components is the number of distinct pieces. So you can see that in each one of these networks, there's a few components. It's not just one small world. The percentage of isolates, I think, is really interesting. At the Hollywood network, it's ranges from 25 to 30%. In the beaches, it was 15 to 30%. So it seems like there's more variation along the beaches in terms of how many isolates we had. The size of the largest component in Hollywood was kind of consistently 52 to 58%. So it's like a little more than half. In Venice, it was interesting because the first two waves, it was 2/3 to 3/4 of the network were in that component, and then that third and final wave was there just wasn't nearly as much connection. I mean, we actually even did some kind of qualitative talking with the agency afterwards, and sort of said, things seem different here right now. There had been some gang-driven violence in Venice that had dispersed the homeless youth there a little bit more. So there were fewer of them in the study by a little bit, but more than anything else, they just weren't. There wasn't like a sense of community that had been there in the previous waves. And I don't know what exact. That seems to me like a period effect of some kind. But here now, what I'm going to share with you is how much turnover there was. This is the thing that blew me away. I had a sense from looking at agency data, particularly at my friend's place, that there was going to be a fair amount of churn in these systems, but I had no idea how bad the churn was going to be, particularly in Venice. So the blue bars represent how many people in that wave are new participants that we hadn't seen before, and the red are the people that we had seen before. So you can see, Hollywood, we have about 60% new, 40% are returning. With the beaches, it's 82, 86%. I mean, almost everyone is different. There's just this, so that makes longitudinal data analysis really tricky, because there's just not a lot of people that we have more than one response on. In fact, we only have about 20% overall of the population do we have more than one wave of data on. And so I think those young people are probably an interesting special case, the stable young people, and maybe it's worth trying to understand how they relate to the rest of the network. But right now, I'm left with panel data that has very little replacement. Okay, so kind of coming back to how does this help us with HIV prevention, which is, I know, what we're all in the business of trying to do. So the first thing that I thought was worth saying was, how much is HIV risk behavior going on in these networks? And obviously, it's a lot, right? So most everybody is having unprotected sex. So we asked them, we did this as an event thing. We said, think about the last time you had sex with somebody. What did you do? Who put what where? And so you can see that about, at best, 45% in one wave at my friend's place said that they were having unprotected sex. At worst, we had 63% at one wave in Venice where they're having unprotected sex. I mean, so unprotected sex, very, very common. How about HIV testing? Percentage of youth reporting HIV tests, much higher in Hollywood relative to Venice. I think that has everything to do with the proximity of testing locations in Hollywood and the fact that testing is incentivized for homeless youth. In fact, we have a subsequent thing that we're doing with homeless adults right now where we're asking them, why did you get an HIV test? And it's a surprisingly large number that say the reason they got an HIV test is because they were given a $10 incentive. It's about a quarter of them. I bet for youth it's even higher, but we don't have that data. But this is, so it's a problem. We want to increase testing. We also want to increase talking about condoms. So can youth reach one another? So I think one of the things that I'm concerned about is youth. We've got a lot of isolates, so I'm a little bit concerned about a peer-driven model. One of the things that we're going to have to work on is how do we get young people, if we are going to train them to be pure, popular opinion leaders, getting them to start talking to young people who aren't necessarily their friends, who may be people that they don't even consider them, so they're going to have to go outside of just their networks. We're not going to be able to do a model where it's just simply, I talk to my friends who talk to their friends who talk to their friends. And likewise, it's only, it's a majority, I guess, except for in that one network that's in the large component, but it's still only about half the network most of the time. So one of the questions that I asked was, when people delineated in their network, I asked them to talk about which of these people were their friends, and homeless youth are very, specific about who they consider to be a friend, and that is marked by a green line. And I also asked them who were sex partners, which is marked by a red line. So you can see, I guess, one of the things that strikes me here is that I think despite the fact that a lot of homeless youth think of themselves as being in these long-term stable relationships, which certainly, there are some of these, a lot of these young people are like, well, this is my boyfriend, this is my girlfriend, I'm having unprotected sex with them, but they're my boyfriend, I love them. And you certainly have a bunch of that going on in the dyads, but you also can see there's a bunch of people that are having sex with multiple partners. It's certainly not, it does happen. And, and then what I wanted to know was, okay, who do you talk to about condoms? So this is just the communication network. These are just people that you talk to at all. And then I'm trying to break it down into, is this a friendship relationship, is this a sexual relationship, or is this just an acquaintance relationship? And then here, what you can see is, when we ask them who did you actually talk to about using condoms, you can see that it's a radically smaller picture, and you can also see that almost none of the gray lines stick around. It's almost only the green lines and the red lines. And so actually, if you quantify it, what you find out is that 51% of the sex partnerships were relationships where people were talking about condoms, which is, I guess, not horrible, but that doesn't mean that half of the people that are having sex with one another don't talk about condoms, though, which is, not great either. But it's definitely a lot less than friends, which are the next bar down, versus acquaintances. So I think one of the other things that we have to think about is, when you're doing popular opinion leaders with these young people, they already have, going into it, sort of a comfort level of who they want to talk to about sex risk, right? Like they may be willing to talk to about sex risk with their sex partners, or half of them are. They may be willing to talk to their friends, like about a third of them are, but not too many of them are willing to talk to these acquaintances. And then we've got this whole other level of people that I just mentioned that are sort of the people that they don't even consider their acquaintances that we need to get to. So that's going to be, I think, a bit of an uphill battle. So this is the second network. You can just see that
Along with the data and condom discussion, did you have the actual condom usage data?
Yeah. So and I didn't overlap them. So these data are the actual, these data are the condom use data if it happens to be that partner. But we actually asked them, when in the social network interview, when we said which one of these people are your sex partners, we then subsequently asked them, the last time you had sex with that person, did you use a condom? So we have specific to each of those relationships, the last sexual encounter, whether they used a condom or not. So it's, I don't know that that's the world's most satisfying. I know that sometimes we want to talk about like condom use frequency, do you use it, most of the time, all the time, and we just have this event-based, but we also were thinking that was more concrete.
I think the issue with condom use, it would be interesting for you to look at is when people are engaged, like with their boyfriend, girlfriend, they're less likely to use condoms.
Absolutely.
That's the piece that I think we'll capture eventually, but it's so, and I think tied to some of those connections, if they're in a relationship but they're still engaged in sex with someone outside of the relationship and they're not using condoms, I think that's where your risk is going to be greater, rather than looking simply at condom use, not using condom. I think it's a little more complex.
It's very complex, and I think that there's...
Especially for interventions.
And I think that there is, as I've been looking at these data from a sort of another perspective, just kind of looking at where in the network are people who are having unprotected sex located, and where are the people in the network who are getting HIV tested located, it seems like there's a somewhat of a, it's not very statistically satisfying, but it seems like there's some movement toward the core of these networks, away from the periphery of these networks for both of these things. So which almost speaks to there being a norm around having unprotected sex but getting tested, and maybe that means that they think because they're getting tested that and most of them know their status, that they're safe, or maybe it's just that they don't really care about condom use and they're being incentivized to get tested, and that just reinforces, oh hey, this is an okay behavior because I got lucky and I haven't gotten this, I haven't gotten HIV yet. I don't know, and I feel like there's probably some good ethnographic data or qualitative data that needs to be collected with these young people to really talk to them about, okay, you're not having sex with a condom. Why not? Like, what's that about for you? And I think that a lot of it has to do with relationships, because when I've looked at these data before, people that talk about having only one partner are more likely to report unprotected sex than people who have multiple partners. So if you feel like you're in a stable monogamous relationship, forget about it. You're not using condoms. If you feel, and the thing is, but unfortunately for these young people, is those relationships don't really last that long, and they're in high-risk networks to begin with. So it's kind of a false sense of security, I think, which is really worrisome, because I mean, I don't know, you've done some work with homeless youth, and Maru's definitely, I mean, it's like, this is my boyfriend now, I'm totally in love with them, and then like 2 weeks later they break up, they never talk to each other again, they've moved on to the next person, they're having unprotected sex with that person, then with unprotected sex with the next person who's their fiance, or I mean, it's like there's a lot of, sort of attribution of, deep commitment and connection that these young people make, in part I think because they're just so desperate for those connections and that sense of commitment, but it leads to not using condoms in a network where there's a lot of, multiple partnerships and there's not a lot of discussion about these things. So the HIV testing results look similar, like, very few people are actually talking about HIV testing within their network, it's mostly with sex partners or friends, and much less with acquaintances. So as of now, as I'm kind of thinking about writing a preliminary paper where I sort of share some of these data, I'm thinking about sharing, one, the sort of massive churn of these networks and kind of how unstable these networks are, and the fact that instability makes it so that it may be difficult to train young people because they're likely to leave. 6 months later, they're not going to be there again. So that's, I don't know how long your POL model went, but I mean, it was at least 6 months, wasn't it?
Yeah.
Right. So I mean, we're saying, probably if in one network 85% are going to be gone, and the other network 60% are going to be gone. I mean, there's not a lot of stability. The other thing is, I think that there's some conversation and connection issues that I've said a few times. I won't go over it again, but getting them to talk to somebody other than just their sex partner, and particularly these people that they kind of are keeping their distance from about these difficult issues, seems like an uphill battle. I mean, not impossible, but something that we're going to have to really strategize about. And so I think that one of the things that I think is interesting about this is that we've known for a really long time that homeless youth's networks on a individual level are filled with a lot of short-term relationships. And I think the thing that this tells me about that I didn't know before was, it's not just that I stopped being friends with Dallas because we got into a fight over, who stole the weed, but it's that Dallas took off. So part of why, or I guess in this case it's because I took off. So Dallas isn't in my conversation network of this last month anymore because I left, and not because necessarily there was this great falling out that happened, but just because there's so much movement of these young people. And I think that wasn't part of what I thought was going to be going on. I think that I thought, over time I'm going to see that people who were friends aren't friends anymore, and that doesn't seem to be so much of the case. It's just that the population is just being completely turned over, or largely turned over. And so the dynamics that people have going on, I mean, you have some relationships that endure past over that period of time, but most of them don't. And that actually reminds me, I need to look at what percentage of the dyads actually survive from round 1 to round 2 to round 3, because that's another, really, I think, will be another piece that's telling, because I think that it's one thing for there to be a lot of churn in the system, and it's another thing for there to be a lot of change in who considers whom a friend. And I think that that's something I'll have to look at too. So I I have no idea how to statistically analyze these data. Generalizability is also a problem, right? I mean, you know, this is 2 networks in LA. Is this anything like what happens in San Francisco or Austin or Baltimore? I don't know. I mean, my feeling is I've talked to more people who are providers in more spaces around the country over the last few years that there's really 2 kinds of homeless networks, that are, homeless youth networks. There's one that looks a lot like Hollywood, and there's one that looks a lot like Venice, where there's one that's very transient, and that's in cities like Seattle and Austin and some of these other kind of cool cities that these kids travel into. And then there's these more stable networks that look a little bit more like our Hollywood network, and that's like cities like Baltimore and Chicago and St. Louis, where people, you know, you're kind of not homeless in Baltimore unless you grew up in Baltimore for the most part. And at least within Hollywood, you know, I think a lot of the stability of Hollywood's network is because you have a lot of locals that are there. So it's a lot of indigenous LA, you know, LA grown youth, and that's, you know, and so I think that it's not entirely ungeneralizable, but I don't know that NIH is going to give me enough money to go and do this again in other cities. So thank you especially to Harmony and Haley and Norwita. And then, I don't know, what do you guys want to ask me about, you know, that you haven't interrupted me about already? So, Tom, yeah?
No, it's, I think in one sense, when you just described about the 2 types of networks, and certain ones are like more like Baltimore and certain like Chicago, and certain ones are more like Seattle and Austin and stuff, is an insight. So
Mm-hmm.
that's worthwhile. I think I would anchor my thoughts in we had an email exchange over the summer about PrEP, and I made a similar point in that context, that in the traditional statistical analysis paradigm, you have units of analysis that, in order to draw inferences, they're supposed to be independent in the sense that they don't interfere with one another. And so that non-interference of units, which is sometimes formalized as saying that, you know, the effect of a treatment on that unit depends only on the treatment received by that unit and not on a treatment received by other nearby units. Well, network data are going to completely blow that out of the water. So you're in a setting where the units as individuals, at least, aren't going to be satisfying the usual statistical assumptions. It might be that the whole network itself, like when you think about one in Austin, one in Baltimore and stuff, then at that level it does. And I think that when you alluded to the dyads, like what proportion of dyads survive from one time point to another, well, now those might, you know, a dyad is something of a subunit within a unit that you could then, I think that going yet further, there might be some angles on that. Are there, you know, quadruples or something? Are there like, you know,
Right.
You know, double dating, whatever the or
well, right. Are there triads or
which would raise complicated HIV prevention issues.
Mm-hmm.
That might be something to generalize from dyads. And anyway, that as it related to PrEP, I analogized it also to like a needle exchange program. That it would be hard. You know, it's kind of an empirical question. The extent when you do PrEP in a community, it's hard to analyze the data at the individual person level because there could be these interferences and people, you know, by taking PrEP, they might, you know, engage in then riskier behavior or whatever. There are all kinds of, but it's kind of an empirical question how much of that substitution kind of activity is going on, and you might be able to, just by tracking the prevalence of HIV in the community from one time point to the other, you might be able to see an effective treatment. And so, I don't know if that's so helpful. The peer intervention, I'm not sure quite how to frame that. But anyway, I think just the the thinking about the units, I think, could be helpful in making progress and using the data for other
Yeah.
purposes. So.
Yeah. Thank you. Go ahead, Lee.
Yeah, and I'm going to read this.
Okay.
And I have 2 comments. Thank you, first of all.
Oh, sure.
And for the wonderful presentation. And for the network, I know the challenge is, first, how to identify the network. And secondly, what do you do about it? And I think from your presentation, I see you talk about peer leader model. I think it's really relevant because you talk about they don't really talk about sex, protection, condom use. I think for POL model, actually, the intervention is to teach people how to do that. So it's not like based on they already talk about that. So I think that is still relevant and for future intervention pilot. And also, you mentioned that those youth also come to the agency. So there's a different opportunity to pair, and at least right now we're thinking about intervention actually to pair those adolescent leaders, peer leaders, with the service provider. And so that way, actually, service provider can serve as a support for the peer leader and also provide a professional service. And also you talk about those youth actually have some stable contact with agency.
Yeah.
So with that, I think you probably have a better chance to reach more people and provide service. That's just common.
No, that's really helpful because I think that I do sometimes struggle between thinking about how much are these conversations actually happening right now, and what does that say about our capacity to train young people to have those conversations. And I think you're right. I mean, it's important to keep in mind that the whole point of the POL model is to teach them to have those conversations. So they don't necessarily have to be having them ahead of time. Although I do think that these data suggest that they may have levels of comfort with different sorts of peers around talking about these things, that we may want to strategize and not just assume that, any kind of relationship is just as easy as another to start these conversations with, but maybe POL even accounts for that already. But I do think that this is really interesting, this idea about the stable contact with the agency, right? Because I think one of the challenges is going to be, if this population is as transient as it is, you probably want to be, one of your selection criteria probably should be picking youth who at least intend to stick around for a period of time. And with connections to agency staff, I think that becomes much more realistic because it's, that relationship is going to keep them coming back and it's going to support them through the sort of negative peer influence stuff that's going on in these networks as well. Yeah.
I think it would be good for you to step back and think a little bit that these are adolescents. So some of the relationships that you're seeing, like they're talking to friends because that's what adolescents do. They talk to their friends. So I think if you're thinking about the peer model and some of the conversations you want them to have about safe sex, probably they need to be at the level of their friends. That may be a place to start. I think if you could add some descriptors to kind of who's in these networks, it would really be helpful because you talked about some differences, demographic differences between my friend's place and Venice. But I think even if you look, you can make some connections, like are these, like kind of characterize who's are in these networks even by gender, I think would be helpful. Not so much race, ethnicity, but I think by gender and also by age if possible, because my sense is that our data from Project Hiv showed us the kids who are probably more connected to agency people are probably your younger kids. So how you intervene with that group might be different. So I think if you want this kind of POL model,
Yeah.
different types of POL models depending upon who the youth are. I don't think your data suggests it's not going to be one size fits all.
Right.
And I think you're going to really kind of cover maybe multiple interventions or kind of tailored POL type interventions. Just to repeat, I think
Thanks,
if you
Lily.
put that adolescent hat on and think about things.
Yeah.
They're adolescents first, so a lot of the behaviors are attenuated in some extent, but there's still behavior issues in adolescents.
Well, and that may also, that kind of comes back to some of the conversations that I feel like I've had around housing interventions recently with providers, which is this frustration that providers feel around particularly the researchers kind of coming in and saying, this is the best intervention, and feeling like more that what would speak to them more is, here are a few interventions that work well, and depending on who you are, this intervention might be better or that intervention might be better. And maybe even part of what I say with this is that POL might be great for the young people that tend to be part of this larger kind of 50 to 70% of the network that are interconnected with one another, where there's a lot of green friendship lines, where there is some talk about sex going on already. That might be good, but that's not going to fit these other guys around the corner, and it's not that we should not worry about HIV prevention for them, it's just POL is not going to be for them. And so even if you as an agency are going to launch POL, you can't think of that as being your one silver bullet. Like, you're going to need something like, for these guys, maybe you need something like CLEAR, right? Like, a one-on-one short-term prevention intervention. Because it's not like, there's definitely risk behaviors that go on with these young people. It's just that they're not engaging in their risk behaviors with the other agency youth. They're engaging in their risk behaviors with friends and even adults who are outside of this one bounded network. That's kind of the complication of, one of the things that I found to be really both exciting and frustrating with these data is that because I have this complete picture of everyone's personal network, and then I have this one interconnection network, I have two very different lenses that I find myself kind of flipping back and forth between, and I find them hard to reconcile. My former student Anamika is much better at combining them in her papers, where she'll sort of say, well, I'm going to look at these interconnections, but then I'm going to also look at, among these people, who else is connected to a parent or who else is connected to a case manager. Or, like, she kind of treats those other network properties almost as if they're individual level attributes in her models, which makes sense because they are individual level attributes. And so then it gets to be a more complex understanding of both this world and the world that surrounds that world. But I find that I see her do it and successfully with a couple of papers, but it's hard to, I was taught in this very dogmatic 1990s kind of way of thinking about network data. Like, you either do this kind of network data or you do egocentric network data, and never the twain shall meet. But that's probably not an accurate depiction of this world. And I think, one of my frustrations is, understanding that, like, oh, a bunch of these people might have case manager ties, a bunch of those people might have case manager there's a lot more going on in these networks than just this one network. There's a lot more going on for each individual that is social network related than what's going on just in this particular network, even though this particular network arguably is a very, very important part of their day in and day out sort of street life experience.
Just to remind us again, this network is the fellow service utilizers?
Yeah, so
agency.
everyone here came at least once during the month that we were there to this agency, and it's their connections between one another.
I had another thought that popped in my head for a different reason. I was looking up social proof of a social psychology phenomenon. It's referring to a study where they were trying to get people to use fans more than turning on air conditioning in the summer. They had 4 different signs. One was you can save $50 a month on your utility bill. One was you can save this much in terms of greenhouse gas emissions. One was more generic, it's a socially responsible thing to do. And the 4th one was 77% of your friends and neighbors already are doing it. And the one that was most effective, what did he say?
probably the last. Yeah.
And I had, this is kind of I mean, one of the hard things about this population is that you're trying to get them to do something that's a pro-social behavior when a lot of their identity is antisocial, I would say.
Mhm.
And I had this thought, and this is a little bit far afield, but maybe not. When I went to the Hockey Hall of Fame, it used to be that hockey goalies would sort of pride themselves on being tough by not wearing a mask. And it finally, yeah, and so you'd have these like horrible looking, contorted looking stuff. I mean, this had to be decades ago. So you'd have these like old pictures of hockey goalies with these contorted faces. And then it was finally when the best goalkeeper decided to wear a mask, that now everyone wears a mask, right? When you don't think of a hockey goalie not wearing a mask. So that, I was thinking, I wonder if that would work as an HIV prevention campaign to say, look at these contorted faces, appeal to their vanity. Like, look at the horrible faces of these hockey goalies decades ago. Well, now hockey goalies all wear masks, so therefore wear a condom. I mean, it sounds like this doesn't make a lot of, the leap is a fallacy at a logical level, but it might work, I don't know, or something like that, that appeals, I think that appeals to something that they would care about, which is their image, self-image.
Yeah, I mean, there is something about social proof that I think, Norita and I have kind of struggled with for the last few years, and we're thinking about, the viability of different kinds of network-based interventions for homeless youth is just, are you potentially asking them to give up the thing that they primarily view as their main bit of social proof by asking them to get involved in these, pro-social HIV prevention behaviors? And yeah, no problem. Thank you, Jay. And so I don't know. I mean, it's a challenge, absolutely. And I'm not. I think that we do have to figure out some way of getting them to buy into the importance of this and seeing it as something to sort of value socially. And I don't know if part of that is 7% of your friends are already doing it, and so or if it's that they need to see the coolest person in the room do it, or if it's that they, I don't know. It's
also challenging because it's such a vulnerable population.
Mm-hmm.
I mean, a kid who's 17 on the streets developmental is probably more like
Yeah.
So even when we're thinking about these interventions that have really been developed for adults and pretty high functioning adults, and then we're trying to do it with young people who have a lot going on.
Yeah.
Difficult.
Yeah. Yeah, and I'm not sure it's as easy to do an HIV prevention intervention with these adolescents as it is to, say, do a smoking prevention intervention with kids in a middle school, right? Where it's like most of those young people aren't smoking yet anyway, and so you can get them to, you can get the cool kid to be, on board with saying, hey, smoking's dumb, we shouldn't do that, blah, blah, but I think it's harder to think about getting the coolest kids in this network to say, oh yeah, we all need to be using condoms all the time, and but doesn't that sound preachy? Doesn't that sound, I don't know, it's probably not impossible, but I think more challenge. I think I every time I get deeper into these data, I feel like there are more obstacles to doing a peer leader intervention in this population than I feel less, and I think that that's one of the things that I want to try to convey to a certain extent with this paper that I'm sort of kind of envisioning coming out of this. This is a presentation that I gave at APHA about a month and a half ago, and then I kind of worked on it more to get ready for this. And I'm just thinking, trying to sort of have, not saying that this is a worthless endeavor, but definitely having cautionary messages about these are obstacles that you're going to need to try to overcome. And I almost think more, the more I understand about these networks, the less enthusiastic I am about this intervention. I mean, I think the more enthusiastic I am about the sorts of network level interventions that Norita and I have been talking about that are more about connecting these young people with people outside of the street, finding them adult mentors that can provide them with alternatives to this network space and those sorts of things, as opposed to, oh yeah, convince your friends to use condoms. I'm just not sure that that's the best use of our time and energy. But then I also feel like a horrible naysayer, but I also feel that's supposed to be part of the point, right? I mean, you're supposed to try to figure out what's going to work. And I mean, with the issues of implementation science are really like, okay, so we've got some things that worked in some places, but but how do we figure out if they're going to work in others? And I feel like this is sending up red flags for me about this kind of intervention, which I was really enthusiastic about this kind of intervention about 5 years ago. I was like, yeah, this is what we need to do. And now I think this is probably a waste of time and money.
I do tend to agree with you that honing in on trying to work the most popular person in the network to be a crusader for a pro-social cause, to me sounds like a lost cause.
Mm-hmm.
But I think that the way modern advertising goes, there's so many, the connections between what the ad is about and what the product or service is are sometimes so remote. Like you had, American Express talking about Small Business Saturday or something. I mean, it was a joke, but I'm sure that was a pretty effective campaign. I mean, and so they're talking about, as if they're supportive of the whole mom and pop, business paradigm, and it's just an association that they're drawing, they're repeatedly making it, and so I do think that there would be a way to appeal to, I don't know, the vanity, self-image, vulnerable. I mean, in some ways, so they connect with something that they identify with, and then the hard thing is how to make the condoms be the product or service that they are associating with it. But I don't know, there are all these non sequitur commercials,
mm-hmm.
and then the last thing is what they're trying to sell you on, and here it would be condoms. And if you had a clever social marketing framework like that was all about non sequiturs that didn't make any sense, it might actually make some sense.